So the thoughts, views, and opinion expressed in this presentation are slowly belong to the presenter. However, concepts are supported by the literature. A seed grows with no sound, but a tree falls with a huge noise. Destruction has noise, but creation is quiet. So, with this beginning, the COVID-19, many of our beliefs and systems we follow are changing. We have heard the loud noise of destruction. So, it's time to regroup and create things quietly. The COVID-19 pandemic forced institutional leaders to rapidly address needs that could no longer be met in traditional ways. So this means seeking alternative means of reaching the students through resources and provide functions for the learners. As usual, the faculty we are feeling centered in the chaos. Now it's the time to create a win-win situation. So the aim of the presentation is how we are going to face the situation as a faculty. So the outline of my presentation is what are the problems and prospects in pedagogy, patient-based learning, and psychological well-being. First, I like to confirm whether what is pedagogy and andragogy, what I mean in this presentation. So this pedagogy is simply speaking, it is teacher centered. If the teacher is playing a role, it is pedagogy. So they used to say that the kindergarten school children, so for those people, they used to start at the term pedagogy, but still in India, the colleges, universities also functioning on the pedagogy board because the teacher is playing a major role. The andragogy, in other words, it is self-motivated. That is the adult learner who has some problem and on his own interest, he is going to find a solution on self-based learning or self-mode. So that is andragogy. There is no role of teacher, whereas pedagogy is teacher-centered. So in pedagogy, actually it is related with not only the content, more interactions and quality, making the students to think, transform the knowledge and entertainment, of course. So all together, giving a professional taste for the students. So it is a role of teacher in the pedagogy. But post
Ma'am, excuse me,
COVID-19,
ma'am. Just one second, ma'am. Can we convert it into a slideshow pattern?
yeah,
And a little more louder, ma'am. You're quite not audible.
okay. Uh, so post COVID-19, our first question is whether virtual classrooms replaces real classrooms. Will online learning blend with the classroom teaching? So because we all in the 3 months time without any training, we jumped into the online, and I really congratulate all the teachers, not only the university teachers, even the school teachers. We all doing a very good job. In fact, the way we entered and where we are standing today, and how much syllabus we catered through the online. So we did an amazing job. But still, we are all feeling that whether this will continue because we are not fully into it. So we feel that the virtual classrooms are going to replace the real classroom because now the many managements are feeling that why can't the classroom can be changed into online mode, and even some institutions are thinking that we have to bring online into a teaching method. So that is because of accreditation purpose on our MHRD, that is Human Resource Development of Government India, is also forcing for the e-learning mode, and whether teaching online is the survival now becoming. So we're all thinking that whether it will continue. If it continues, what we have to do, and what are the problem in that. So now you can see the new terminology, new normal. If any education journal is new normal, that what we are doing in COVID period is given a terminology, new normal. So this virtual education is considered as a new normal for medical education. Though it is started, but it's fully transformed to the virtual education. So now they are saying that teaching method as a new normal. So beginning this virtual education is beginning its life as a online learning or education, where they posted some documents or some materials which the student has to go and see before they are coming for the class or after the class. So in-person class is main important. One is it is the archive of content, so not anything else. So that is the initial purpose of this online learning, how it has come to the education. Then it moved towards an interactive format with the addition of discussion boards or the lecture happening in real time. So all the things comes and joined in the later period. Now, education is not just about classes, it is about interactions, broadening of ideas, free flowing open discussions, mentoring of each student, and so many things. It's a combination of the class. The teacher is not only transforming the knowledge without knowing or with knowing, they are transforming so many qualities, so many values to the students. So while we try to do all of this, a lot get lost in translation on the online platform. So are we looking for this? The institutions are looking for this? Definitely no. So one more problem, the student can, what they used to say as the advantage of online learning is the student can complete the content at their own pace, whenever they want, wherever they are, it is convenient. So this is the very attractive word used by the online educators. And second thing is flexibility. The student can skip. The flexibility, they are meaning it is a time and availability of resources. But even we can feel that if they don't like, they can skip on topics. But book reading habit, finally, yeah, for any deep learning, they have to go and search and do the book reading. So that habit is, there are some research, but I didn't see anything in Indian level, but in abroad, they are conducted a many studies how the book circulation is happening in library and what is the reading habit of the students in the medical colleges. They're telling that the book reading habit is slowly reducing and the depth of knowledge is also uh, disproportionately going on. So this all the things will get affected even more if you come to the online platform fully because we are giving it. So we cannot blame them. So these are all the other things we have to consider. So these points are okay for liberal education, but dental education and medical education, if the students keep and they don't need the flexibility whenever they want, wherever they want, that is not the right thing because we have to formulate certain things and we have to go by because this profession is something where we are dealing with a human being. They need discipline. They need time punctuality. They need lifelong learning. So all the things. So it cannot be they can do whenever they want. So it has to be done the time bounded manner. So that is one of the problems. So it may be applicable for the liberal education or other type of education, but not for the health professional education. Again, real versus virtual. So what is happening? The study reports what they are telling. So given in this trend, teachers, students, parents, and policy makers all assume that now the students, they are all savvy. So they are very familiar with the computerized thing and online mode. So their preference is technology and they will translate everything into technology and their learning outcome will be better if you go by that. So because their taste is towards that. The study report says that it's not true. It is not favoring for the student preference towards the online mode. This study was conducted by the World Economic Forum. So all over the world, the students express their thing that they are not for the online mode. And again, what is the second study report says? The schools are switched to virtual schools, which are experiencing a very large negative effect in the students' achievement that persisted over time. But they recognize virtual schools offer greater autonomy and the possibility of tailoring experiences to the individual needs of the students. It would be dangerous and wrong to extrapolate such experiences to medical education. However, it's a warning with regard to how we implement online learning. So the failures are more than the success rate. So why in abroad they are the people first introduced to online learning? So what is said was the students' attendance is the biggest problem. There they are adult learners. They enter into the medical college by the age of 25, 26, or even cross that. So obviously the 1920 will never enter into a medical school in US or UK. So their attendance is a problem. They are all earning people. For some other thing, they have to earn and they have to spend for their studies. So they have the other responsibilities. So they used to skip the classes. So how to cater these people for theory? They found the method of online learning and transform the classes to online. But the success rate is not appreciable and they are not now supporting for the online. But India now, for some aggregation purpose or some fancy things, we are moving towards online learning either 100% or blending it to the part of the curriculum. We may ask when schools are successful, why not colleges? The successful delivery of education is also in question because learning at the level of higher education and learning at the kindergarten level is different. Even the school level is different. Digital education cannot be applied the same at every level of education. Again, I'm telling in medical education, the same as professional education, dental education, we have to impart value to the concept, not only the study material. So now we have to think, not only the teachers, even the institution which wants to bring online to the teaching mode, they have to think whether we have to balance as a clinician, whether their faculty has to be a good clinician, good teacher, good mentor, or they need to spend a lot of time in preparing the online resources. We may say that once prepared, it is available for all. Again, it will be demotivating the students because they know that whenever we open, it is going to be the same. There is no human touch. So a lot of things are there. In that way, we are going to spend time, especially in this critical hour. So this we have to think. Now, is there any how we are going to change this? How we are going to make it as a positive? So first, we have to consider the purpose. We cannot avoid online fully, whether we like or not. Our institution may want it, or students, some of them may like it. So we have to choose online to an extent. So in that situation, what we have to do? Consider the purpose. There are likely to be difference in which medium works better for which purpose. Means whether it has to go by online or blackboard teaching or any other model, a group discussion, for example. So, what purpose behind the class will determine the medium, but not the only online or classroom. So, the purpose of the content is more important. And analyze the task. The topics that demand more engagement and deeper comprehension is always better to go by the face-to-face classes. The topics that demand only understanding and remembrance can go for the online mode. So this is the one thing when we are splitting the content into online as well as for the offline. And resource sharing. So we are all fed up in preparing the content and recording and then keeping it in the availability of the students. So the best thing is it is a time to share the resources, not only the online. Many things the institution should have collaboration among them and they should start sharing, which will be a healthy practice which is happening in abroad but not yet in India. So that practice we have to start, which will save a lot of time, which will save a lot of money, which will save manpower especially. So this resource sharing concept is nice time to think in this era. And we have to get ready for the unanticipated situation. Today it is COVID-19, but there are countries which placed similar lockdown before, for example, SARS in 2003 and H1N1 in 2009. So many countries have faced the same pandemic situation and they're all better prepared during that time itself. So now they know how to proceed with the clinics, how to proceed with the online classes, everything. So for us, it is the first time and we are doing our level best. But this work will become better and better. So we have to get prepared how to catch the students in those situations. So we have to clearly divide our work schedule. Suppose something happens, it's a plan B. It should not come into a plan B. So plan A always should be handled by the teachers. Then curriculum implementation and approach. So which part? Again, theoretical and practical nature of the curricular component. So if we put the practical related thing into the online mode, again we will be spoiling the core purpose. And faculty training is very mandatory. We need a continuous faculty training in this program because some may be very fast in absorbing things. For some, it will take time, and there are different modes. So it needs a consistent training for the faculty. So we never trained for this online mode either as a teacher or as a student. So they need training to catch the students in a better way. And we have to be ourselves. Means when we are going for the class, it's not only we are delivering the content. We used to motivate the student, we used to mentor the student, we used to cause the enthusiasm, we used to make the situation very funful. So a lot of things we used to literally making the classroom as very energetic, so the very vibrant. So those qualities we cannot entirely transform on the online. So definitely our students will be missing that. So we have to capture our personality, our patience in ways that are different from what we might do in person, but yet to an extent which is authentic. So that we should not lose in online classes. So it is not just the content delivery. We should put ourselves how we behave in the class, and to a greater extent, we should be able to give it on the online mode also. So now the online or blended mode, what's going to happen in future? The teachers need to be at the front line of education and to play a major part in shaping values, knowledge, and the skills of the students. There is no question of sending back the teachers to home and then running the institution with the online mode only for the clinical purpose. No, that is very very uh, critical decision taken by the institution if they plan. So the teachers always need to be at the front line of theory education also, not only the clinical education. We have to, for the classroom education, we have to, for the transfer of knowledge, the teacher should stand at the front line. And a classroom teacher can meet the demands of his students. So if it is not true, then Quizlet and Khan Academy never replaces our teachers. So they are not able to replace. Still, we are running this Khan Academy, Quizlet, though they are surviving, but they were not able to replace the teachers in any specialty, any type of education, even if it's the arts, science, anything. So they are surviving, but still they are not able to replace the schools. If they are better, they have done that. So the teacher-based education, we have to, when we are coming back, we have to concentrate more and more on that, but we have to prepare for some uncertainty. Our second thing is problem in the patient-based learning. So what is our clinical environment? What will happen? So all our students also will come with the mask. All the patients also will come with mask, and we are also going to sit in with the mask. So in that situation, how we are going to face it? So to see, immediately once they join, the students will approach every patient with a fever or with a fear of coronavirus infection, unless proved otherwise. So all the patients we cannot expect to come with a certificate that they are corona negative. So the students will have some kind of fear to do the procedures. And second thing is financial condition of the patient. So from the patient side, how much they will spend for their treatment. So that is a very huge questionable. So many procedures, like if they are going for the aesthetic replacement therapy. So those kind of things the patient may think twice or thrice. So how we are going to manage that? Also, there is one threat: the hospitals where it is cost effective, the patients may move. So that every institution will keep it in mind. And in this period, yes, there is a financial risk for the institution side also. But if they want to put it on the patient side, then we will be losing patients. So this critical situation, we have to consider the economical package for the patient and time and effective care. Once if they start reworking or they start their regular life, we cannot expect them to sit in our waiting room for hours and hours to finish the treatment. As we can say that it is a learning process, student may take their time, but that will not work in the post-COVID period, at least even for a 1 to 1.5 years following this. So we have to be very effective and timely manner of delivering the dental care for the patient. And the most important thing is the physical layout of the outpatient clinics should be changed because the social distancing is one thing and aerosol infection. Now, almost everyone got educated that it may spread from one person to other person through droplet infection. So, if we put our clinics in the thing which we never thought previously, so we know about how our OP setup, how the chat arrangements will be. So that thing will not work out. Either we have to change it. So instead of if you are keeping we have to make a plan first of all for this much square feet, how many chairs we can put and how many faculty should stand there and how many clinics they need to increase, or whether within the existing situation they may remove some chairs and make it as a bigger and well spaced and allot the doctors in a different time, maybe 3 hours like rotation. So some changes should be made in the working schedule as well as in the physical layout of the outpatient clinic. That is very, very mandatory. And back to normal, how and when. So this is the biggest question for that. We all should work in a team to provide an effective care in a correct way, in an accurate manner, and that should be on time. So if you work together and have a plan for that, because a good plan will change the individual, change the organization, and it will do wonders. So this is the thing what we have to think to make the patient to enter in our hospitals and provide the patient touch for the students. So yes, we have to think together. We have to take a chance to examine all elements of our clinical program because as we can assume that for a period of a minimum 1 year we can keep the getting the patients for dental treatment is going to be a quite difficult, not only for dental, anything which is not emergency. So now based on their psychological condition as well as economic condition, they may think twice or thrice to put themselves for the procedure. So we need to think all the clinical components and then review the curriculum for the future dentist. So which is really essential for them to go and practice. It should be a practice based than the training mode. So we need to train them with the available clinical material to the thing which they are going to do in their real life. So we have to pick it up those skills and concentrate more. Also, we start believing in the formative assessment. Assess each and every component of the clinical competency at a frequent interval so that now we land up in a situation where we are not able to conduct examination with the patient. So we need to review the records. But in the records, we know how we used to assess. We know about individual students because through heart we are seeing the students, but not on through paper. So everything is not, we are not able to assess. For example, I am telling, we may assess the quality of the work, but we never assess the quality of the 21st century physician, like their communication skill, like how they are moving with the patient, how they are able to deliver the message to the other healthcare professionals, how they are referring. So a lot of things we never used to assess. So these type of things also should be put into our curriculum, and we start practicing that, and we should start assessing those qualities also. Of course, along with their technical skill and knowledge component. Now, so what? How we are going to tackle this? First, we have the review of infection control practices. So this, even I will say that I agree honestly, we need to improve our infection control practices. This, I can share a small conversation which happened between me and one of the colleagues whom I met in a conference. So I asked, he is an Indian working in a different place. So I was asking the best medical institution, of course, AIMS or all CMC, many institutions are there in India, and they are the best outgoing students, and they're all taking opportunity and working in the so-called other hospitals in the abroad, where the Indian politicians or the big people are going and get admitted. One day, most of them are treated by the Indians also. That is also happening. So yeah, so what is the difference? Why can't they can done in the India? It is due to availability of the newer investigation aids or the uh, instruments that is helpful for the treatment. So he simply said that nothing. It is an infection control protocol. So in their places, in their hospital, the patient room is 100% protective. There is 0% microbial contamination. But we need to think about that in this situation. So whether it is COVID virus or some other bacteria or few more fungi, that doesn't matter. But our infection and sterilization protocol should be in a very, very, very standard manner. And it is not only that the institution should do on their own. Every individual student should realize that what is their responsibility in keeping the sterile environment. So that is, and many times it is pathetic to see our students that they will pick up the instrument from their college bag and they will start doing it. And they will be hiding an instrument on their hand, and when they, especially for some no to take patients to the other specialty, being sitting in the oral medicine department, we used to they used to put their instrument on the patient's mouth and they used to see whether faculty are noticing them and they used to run away. So these practices are all happening because of the ignorance. We are not giving that much importance for the infection control and sterilization. So that need to be changed from the bottom line, that is students. So we have to keep reinforcing the infection control protocols for the students. And then training for the use of rubber dam. What our DCA guidelines says, use rubber dam and high volume suction. So this has to be started practices, because if it is going to control the infection spread, then why can't we start using that in our daily practice? So that we have to start using and give a training for them. So we need to call the students before they start seeing the patient. Just we have to update them in what way they have to change on before the previous work experience and now how they have to. So this training is mandatory before allowing them to see the patients. And we have to create a safe campus environment. The students should feel that this place is safe. So I no need to scare about every patient is coming with a COVID patient, or I'm in a unprotected way. So that environment should be changed, and it should give a good feel for the students. So all the protocols should be properly followed. And we need to build trust in patient care. So once the patient comes or enter inside, they should feel the change first. So I visited the hospital previously and now I'm going, there is no change. And I don't know in what way they are going to protect. There is no guarantee whether I will become out of the treatment hall without COVID. So those kind of things will be running on the patient's mind. So they should not give chance for this. So we need to build trust in patient care in as a team again. We have to use multiple modes and to build the trust on the patient care. So we have to address the long-term effects of the short-term changes in dental education in response to the COVID-19 pandemic. We need a proper roadmap or the plan. So how we are going to function in future. So that we need a plan. Without that, if we start doing that, so taking these guidelines or some instructions, that will not work out. Every institution should have a plan how we are going going to run for the next years, a few years or 2 years, 3 years, and how following that, how we are going to keep our practice. So need a plan at the right time. So now in the patient care, what we are going to do? Create an environment in which all members of the institution, students, faculty, administrators, and staff all should thrive in a near term, mid term, and long term of COVID-19 period. So near term in the sense it is not immediately. Mid term where after the vaccination and those kind of trial procedures gets over and they people start getting the vaccinated for COVID-19. And long term where there is no isolation of COVID virus from our Indian population. So for this we have to get ready. For that, we have to prepare a plan. And till the time, we should make sure that we all should survive and we have to take the precaution as early as possible and start back to the normal. Now, psychological well-being. We are really getting scared that once we start working in a regular way, how it will be. Because we didn't take classes for a long time, so to cater those things, so how we will be expected to work. So to improve the patient flow, how will be expected to work? So a lot of questions are running in their mind. So we don't know. So that psychological well-being, we have to keep ourselves in a good way, as well as our institution should help to make us to feel good. The teacher burnout is the problem. So they are feeling the job security because, as I said, that there is a financial risk for the institution side also, how they are going to manage. So everybody is having a scare, worry that whether my job is secured, I'll be continuing. So these things should be first watched out. So this the institution should give the guarantee that it is safe and secure place for them to work. And pay cut, which will cause a great psychological burden in the faculty mind, and that will uh, demotivate the quality. So the pay cut is one of the critical issues which we need to think about. The institution should think about before doing it. So far, I never heard any institution is doing that. Thanks for all the institutions, and we are blessed to be in that kind of prestigious institution. But in future, such situation happens that they have to think twice before doing that. And respect. The institution should respect their teachers because the well-being or the good feel of the teachers, as well as the way how they are respected by the students, depends they how the institution handle the teachers. So it is a cycle of events. So if the institution gives the respect, and that automatically will improve the self-confidence of the faculty, and they will work more. And working hours. So it is not that we are going to compensate whatever the 3 or 4 months out of institution, that it should be in the campus life. So that is not the right way of making the faculty or teacher to work. So it will cause again a burnout. So we have to work in a very effective way, not on a very a faster way, or not in a very hard working. We need a smart working period now. So this is the way how we have to tackle this situation. So these four things should be taken care by by our institution. Then the quality of our teaching or the quality of our output will be really better. So how we are going to do this? So as a teacher, what we have to do? We have to preserve high academic standards, whether it is teaching, whether it is assessment, or whether it is the treatment process, anything. So we have to keep a high standard. So for that standard, we need to prepare. So how we are going to do that? And we need to integrate new scientific developments into the practice. So to whatever the patients are available and whatever the resources are available, with that we have to keep moving for developing more research work and other things. So we never used to feel as a gray area. Either we should be black or we should be white. So if you have some confusion on the mind, then this will not work out. So we should not think that whether I don't know whether I will continue for next 2 years or 3 years in this institution. So why should I go for maintaining the standard? So it is none of my business. So what the higher officials are telling us, I will follow that. So that is not the right thing. So you have to decide and we have to do that. So it is not that if we follow the instruction alone, the professional will flourish, and no way we are going to meet any gain as a profession as a whole. So if the dental education, as an educator, if you want to survive, we have to go for the high standard level in teaching, in practice, as well as in the research aspect. So the clarity and happiness at work matters a lot. For that, we need to prepare ourselves. So now, just it may look different than before, but one thing is it is certain in this uncertain time is climate change in better education will redesign teaching jobs as more meaningful and motivating, build culture of creativity and generosity in teams, and even make the entire organization more productive. So no need to get scared that it will change things in a worse way. So it is more protective and it will be in a very flourishing way. So keep this positive attitude in our mind and we have to back to the reality very soon. With this, I want to sincerely convey my acknowledgement to Professor Vijay who is my PhD guide and always encouraged for such kind of works. And Professor Kandasamy, who I never forget in my life because each and every presentation, if I start, I used to remember his face only first. So the instruction somewhere from his guiding me in a very distant mode as a real teacher. And Arvind Warrior, my friend and the head of the department, who used to always encourage and balance my work schedule in the department and for the education work. So, which is giving me a lot of free mind to work for it, so which I'm enjoying now. So, I thank all three and especially all the audience who is really came with a lot of interest. I don't know how much I fulfilled your expectation, but I thank all of you with a folded hand for joining in this presentation. So these are all my reference.